Hello, my name is Dr. Liz Simpson. I am a registered health psychologist with the Healthcare Professions Council, and I am also a chartered psychologist with the British Psychological Society. I am a senior lecturer at Ulster University, and I have worked there for over 20 years. I have almost 30 years experience of research on the menopause, and my research is in this area really began as part of my master's in health psychology when I did my dissertation looking at the psychological impact of the menopause on well-being and quality of life. That led on to a PhD based in the Royal Victoria Hospital in Belfast at the Regional HRT Clinic with the late Professor William Thompson, who was then head of obstetrics and gynecology at Queen's and within the Royal Complex. So I did my PhD part-time, so I was there for about 8 years and feel that I got a really good grasp and understanding of the types of problems and issues that women can experience during the menopause. As a health psychologist, I adopt a biopsychosocial approach to health, and I'm going to explain what I mean by that. I really am interested in those underlying sort of biological changes and processes, and in this case, in the menopause, changes in hormone levels and their impact on our physical health and on our mental health and psychological well-being. Also, how this time in a woman's life impacts on social situations, such as relationships. That could be relationships within the family or the workplace. There's a lot of social change, such as becoming a grandparent or a carer, or perhaps being faced with retirement or divorce. All of these things have the potential to impact on quality of life and psychological well-being during the menopausal transition. So the focus of my work has really been to gain a better understanding of the menopause itself and what those health needs are of women experiencing menopause at this time, and to design and implement more effective interventions to promote well-being in menopausal women. The outcomes of this 30 years of experience and work in this area has led to me supervising several PhD students and numerous MSc projects on health and well-being during the menopause. I have published over 40 scientific papers and 2 book chapters, really sort of focusing on healthy aging and how we can promote well-being as we get older, presenting my work at national and international conferences. I have collaborated on funded projects on menopause, one with the Alpro Foundation, looking at the health benefits of soya drinks on menopausal symptoms, mood, and cognitive function. I have hosted a number of menopause cafes and had a number of invited public talks for organizations and community groups, really to try and raise the profile of menopause throughout the UK and to provide a space for women to share their experiences of menopause and this very kind of personal and private time of their lives. So what I'm going to talk to you about today is really looking at physical activity and how we can promote and why physical activity is important for menopause. So within the University of Ulster and within my own research, we've done a number of studies looking at physical activity sort of across the menopausal transition. So during the peri and post-menopausal years. What do I mean by physical activity? Well, physical activity really refers to any body movement. So it could be walking, it could be doing housework, it could simply be walking from the living room to the kitchen. It could include gardening and exercise. Why is this particularly important and relevant? Well, we've known for quite a wee while that women tend to be less physically active than men across the lifespan. And this declines further when we go into old age. So from about, into their 60s and beyond, women become even more less physically active and become more sedentary. Physical activity is one of those things that can really improve all aspects of physical and mental health. It can reduce our risk of a whole range of chronic conditions. So it's really, really good for promoting health and well-being. And it's something that women should be thinking about doing when they go into the menopause. We know that women, that menopausal symptoms affect about 80% of women, and these include things like hot flushes, night sweats, problems with sleeping, mood swings, and memory problems, all of which, can be and have been improved by engaging in regular physical activity. We also know that as a result of menopause and declining estrogen, some women may be at greater risk of developing more serious health complaints when they go into the postmenopause, such as heart disease, stroke, diabetes, osteoporosis, and dementia. So again, increased physical activity may help to reduce the risk and promote well-being and physical health for longer in the postmenopausal years. So the research that we have done at Ulster tends to have kind of focused on three sort of main areas when we're thinking about physical activity. And the first area is really around understanding the physical activity guidelines. So I'm sure you will have noticed lots of advertisements about Get Walking and the 150 minutes of moderate physical activity per week. I think that message has been quite clearly conveyed by the Public Health Agency, by the Department of Health. So that's really talking about, getting to do some brisk walking, swimming, cycling. All of those are examples of moderate physical activity. So in our research, we really know that women understand that message. And when asked, a lot of women will, understand what it is that they need to do in order to be able to meet that 150 minutes of moderate activity across the week. However, there's two messages in the physical activity guidelines, and the second one is really around conditioning and strengthening exercises. And the recommendation is that these need to be performed on at least 2 days a week and includes things like weight-bearing exercises, things like Pilates or going to a yoga class or something like that. What we know from our own research is that there's really a poor understanding among women of what these actually entail, what it means, how do they actually incorporate it into their normal daily activities. And they tend to be viewed a bit negatively because women tend to think that it's all about maybe going into the gym and lifting weights, when in fact it's not. There's lots of things that you can do there. The other area that we have kind of focused on is really around trying to promote, looking at those factors that will promote engagement with physical activity and the things that maybe we find difficult and barriers to physical activity, things that might prevent us from being able to engage with physical activity. So we know, for instance, that those things that can help us to engage are things like having a better understanding and a knowledge of what moderate physical activity is or what those conditioning exercises involve, being motivated to promote our health and well-being. And we know that the menopause is a time where our physical health starts to change. We might notice some more aches and pains. We might get a bit stiffer in the joints. So physical activity is really important to kind of help us keep on the move and to get us a little bit more active. Having a value on your health, you should be, understand that your health is important across the lifespan, but particularly when we reach menopause. Due to all of those physiological changes and the increased risk to our health, we need to maintain our physical activity for longer. And of course, it's one of those things that has a whole array of kind of physical and mental health benefits. If we engage in it, we can really reduce our risk of a whole range of different conditions, and it promotes our psychological well-being. It makes us feel happy. It also provides us with an opportunity to, for social support. And getting family and friends and maybe work colleagues involved in taking part in physical activity. Now, some of the barriers or some of the things that might prevent us from engaging with physical activity are things like lack of time constraints, competing priorities, being at work, all of the things that we have to do when we get home at night, maybe babysitting and childminding as well, if we've got grandchildren and things like that. All of these can become competing priorities. Being prepared, for changes in our weather here in Northern, if we know anything, we can have 3 seasons all in one day. So being prepared for that, if you want to walk for a half an hour in the morning before you go to work, and the weather's maybe not great, making sure that we've got a coat to hand or we've got maybe a pair of waterproof trousers and appropriate footwear, being prepared in advance for those changes so that we can overcome some of those barriers. And we also know that, sometimes women can have health concerns and they can worry a little bit about whether or not they're able to engage in physical activity. And physical activity is something, even if you are suffering from some chronic complaints, can be really beneficial and can really change your health outcomes in relation to those as well. So it is really important to think about going. And we know that some people, thinking about going to the gym and things like that, there is an embarrassment around it, but it's not only about going to the gym. We know that walking is one of the things that women really enjoy doing. It's free. And we know that, if you enjoy sort of walking with friends, it can sort of turn into a social activity, going to the park, even with your grandchildren, walking the dog, walking with friends, can be something that can be really, really beneficial and can help to promote and increase our physical activity levels. So from our own research, we have a range of recommendations really that we would like to make based on our findings, and we do need strategies to help empower women to make those choices and to decide what they would like to do in relation to their physical activity and getting those levels up. What I would say is find an activity that you really enjoy. It can be something as simple as walking. Walking is free. Anybody can do it. And it's something that you can kind of fit in and around your busy routine. Even if you get, say, an hour for lunch and it maybe takes you 10, 15 minutes to eat your lunch, go out for a walk, go out exploring, get some of your work colleagues to go with you. Even 20 minutes, half an hour every day, and those step counts and those active minutes will really start to add up and increase. Plan it. We know that everyone is busy and women are working and they've got lots of different things that they have to do. So plan your physical activity sessions. Think, when can I fit this into my busy schedule during the day? And maybe it is lunchtime. Maybe it's before you go to work. Maybe it's after work. So plan when, where, and how you will get a little bit of activity into your daily routine to help manage your time more effectively, so that you're not thinking, oh, I'm not going to do that today because I need to do this, this, and this. Getting friends and family involved. We know that women have said to us, it makes it a bit more fun. It means that if someone else is waiting for you to go for a walk with them, you're less likely to say, I can't be bothered, I'm not going. You will go because they enjoy it and you enjoy the time that you probably spend with that other person. And it's an opportunity to socialize, and it helps to kind of maintain that motivation and to get you out and get you active. And what I would also say is challenge yourself, monitor your physical activity levels. We nearly all have mobile phones. We probably all wear mobile technology, whether it's a Fitbit, and I know there's lots of other watches out there, but, monitor your physical activity levels. So say you're only doing 4,000 steps every day. Think to yourself, could I add another 1,000 steps onto that and get my step count up to 5,000 every day? So increase it, and get it up to the 10,000 steps, which is the recommended amount that is equivalent to 150 minutes of moderate physical activity. So just keep a wee eye on how things are going and monitor that. That's something that we know helps women to think about their physical activity levels and to get them active. So know where you are really in relation to the physical activity guidelines. Know, are you meeting them? Are you not meeting them? And it's, those are there because they've been set. They are argued to be those levels that really optimize our health benefits. But any change is beneficial. Just going from 4,000 to 5,000 steps is beneficial. So a little can go a long way and it can all add up. All activity is important. So it's not about just going to the gym, being a little bit more vigorous with your cleaning at home, cleaning the windows, doing a bit of more vigorous hoovering. All of these things can help to increase your active minutes. So it's not about going to the gym and weightlifting or anything like that. So you should be encouraged, encouragement as a way, also to combat our menopausal symptoms. There's some evidence out there now that's starting to accumulate that suggests that actually being physically active can help us to sort of reduce some of those menopausal symptoms, such as hot flushes, night sweats, maybe feeling a bit more tired, because physical activity is one of those things that can give you a little bit of a boost and give you a little bit more energy. So look, thank you for listening to this short talk on physical activity and why it's important for menopausal transition.